Listen to timely advice from experts as we discuss all things leadership and technology. You'll get the inside scoop on better business practices, from making the most of your technology to leading a company with your head and heart. Pull up a seat with Marco CEO Jeff Gow and President Doug Albrechts. Let's Tech.
Well, welcome back to Let's Tech. Today we're going to talk about something a little bit different that has been impacting us all a little bit differently in recent times. And that's the subject of mental health. For those of you that follow us on Facebook, and if you're not, you should, this You Matter campaign that we're in the middle of right now, this fits very nicely into our subject matter today. And I hope you lean in and listen as we talk about mental health in the workplace. You'll often hear me, if those of you that are acquainted with me a little bit, talk about the term psychological hardiness as an essential attribute for leaders and other high performers. In fact, psychological hardiness is a term that's really gotten tested this year, which means, how do we handle things when things get stressful? And so psychological hardiness is probably code word for how's your mental health? And we don't ask ourselves that directly a lot of times, but you know what? More and more, it's becoming an issue for us. Things like back to school this year. Back to school is a good example of something that was very routine that has caused anxiety and really fluctuation and pause in the workplace. And that was something, like I said, that would have been considered very routine just a year ago. And today, kind of an anxious situation for all of us. And so we have to be mindful of all those little triggers that there are today. Mental health is front and center in the workplace with COVID-19. I don't have to tell you that, with these stay-at-home orders and the unusual start to those of us that had to make our way back into our homes in a lot of cases. And sometimes it was conducive workplace, sometimes not so much. So the environment naturally brings about more stress and more anxiety. It's something all of us as leaders need to pay attention to. This isn't necessarily somebody else's problem or situation. This is just something to be very, very mindful of that doesn't get talked about as often as it should. But frankly, I think we're starting to see more awareness. And my guest today will talk about that and will be a perfect person to help us understand where we can channel some of that awareness and some of the opportunities for us to do a better job of channeling our resources toward those that need it. So we launched the You Matter campaign to raise awareness about mental health and encourage our team members to check in on one another. Today, our guest, who is very passionate about mental health and has been a key resource for us here at Marco and our community, and I met our guest, Lisa Burshak. I met Lisa about a year and a half ago when she was just starting her job here at CentraCare, but she's been in the field of health for 15 years. She serves as CentraCare's Suicide Prevention Program Manager. She's an independently licensed social worker. And it's through this work that she developed a passion for suicide prevention, having worked with many individuals who experience suicidal thoughts. Important work indeed. Lisa's worked with VA Suicide Prevention Program before joining CentraCare in the spring of 2019. So she started CentraCare's Suicide Prevention Program. You're the founder of that, I guess you could say, right? The focus of this program is to be an educational resource to our community, as well as helping CentraCare implement the zero suicide model. So welcome to you, Lisa.
Well, thank you, Jeff, for having me today. I appreciate Marco and your efforts as its leader in really opening up these conversations about mental health in the workplace.
Yeah, I think, today we're zooming in on each other, right? So you're at home today, right? I understand you have a little bit of you're not as mobile. You had a little foot problem, huh? Broken foot? Is that what I understand?
Yeah, unfortunately, that is not how you want to spend part of your summer. But with this year, you just have to roll with the punches a little bit. And I think even today, as we discuss, kind of zooming in on our meeting, in non-COVID times, we might be there together taping this. And so it's just about being able to be flexible and adaptable in how we do our work and in the ways we move forward.
Well, good to be with you today. I'm going to ask you a few questions. We're going to talk about the subject matter that you're very knowledgeable of and many of us are very interested in. But oftentimes we're not sure exactly how do we respond? How do we take the right measures? How do we be good corporations or good corporate citizens relative to this subject matter? So let's go to work. So as employers and leaders, what do they need to know kind of when it comes to mental health? What would be your advice on that? What should we be aware of?
Well, I think it's really important for leaders to really know that the mental wellness of their employees is really necessary for them to create a healthy, productive, and really, in all honesty, a financially successful business. And so I think one of the things that people don't realize is how common mental illness is. 1 in 5 adults in America will experience a diagnosable mental illness in any given year. And while treatment for the most common conditions are effective around 80% of the time, 50% or less of those adults experiencing those mental health symptoms are not engaged in any treatment at any given time. And we know that social stigma plays a huge role in that inability that people want their friends, family, or their workplaces, their coworkers, their managers to know what's occurring. We know that people fear repercussions at work due to mental health symptoms. And it also could be attributable to lack of access to kind of quality, affordable treatment. Maybe they're underinsured or not insured, so seeking treatment becomes more difficult. But we know for workplaces that if employees are receiving effective treatment for their mental illnesses, it results in total lower medical costs overall. It increases individuals' productivity. It lowers absenteeism, and overall, it just decreases disability costs. So there's some real financial incentives for workplaces to start engaging in this conversation about how do we start incorporating mental wellness into our workplace.
Yeah, I think that, a happy workplace, that's a kind of like unicorns and confetti, right? A happy workplace, though, means that people are functioning well and means they're balanced. And achieving that is a moving target and very dynamic. The other thing is when you speak to the subject of mental health, it's not like you broke a foot and you can see somebody has a cast or is using crutches. Oftentimes it's not very visible and it's not diagnosed and it's not treated. So a lot of things going on that aren't quite as obvious there. So in mental health and the providers, I'm in the technology business. Marco's in the technology business. Tell us a little bit about how is technology helping to improve access or support or play a role? And certainly right now, I know for a fact, you can't go into these counseling sessions live. I mean, they're having to use the same tools I suppose we are too. But tell us a little bit about how is technology and what role is that playing in the mental health and access and support?
Yeah, absolutely. Well, I think technology is actually really transforming how we connect with our mental health consumers and within healthcare overall. Traditionally, we do have groups of individuals who have struggled to be able to connect with ongoing mental health treatment. And some of those underserved areas have been our rural areas because of just the time and distance in able to access those services, or individuals with transportation issues. And so really technology allows us to come to their local clinics, into their homes, to come out to schools and into their workplaces, really. So our iPad, our phone, our desktop is really becoming a portal to our healthcare appointments. And I think even for those of us who may not have some of those barriers to accessing treatment, if you think about kind of historically the time it takes for me to take off of work to get to an appointment, to pick my child up at school, take him out of school to go to an appointment, the commute times, those can all be lessened by engaging in telehealth platforms. And it really then can just increase our efficiencies at work and personally. And so I think technology really allows us to meet the individual who's in need of those services where it's best for them.
Yeah, it does provide access, no doubt about it. And I can see where, like you said, it's one thing to have an appointment, get service or support. It's another thing to get there. It's another thing to take the time off out of your busy day. And this way you can do it more effectively. But now let's talk about, that's the positive side of it. I also got to believe, as people are Zooming and WebExing and Teams and all the different video services we're using today, what about the other side of that with technology? Can technology work against us too sometimes?
Absolutely. I think that technology can enhance our lives in so many ways. However, depending on how responsible we really are with our digital connections can really play into our overall mental health. So technology can increase our impatience, our distraction, our need for instant gratification, and for some, increased risk of depressive symptoms. And very interestingly, there's a professor at the California State University who, his name is Larry Rosen, who's really theorized that actually we have a new diagnosis for this. It's called the eye disorder. So very similar to kind of an iPad. And he talks about how some of the outcomes of overusing technology can really look like psychiatric disorders like obsessive compulsive disorder, narcissism, addiction, and even attention deficit disorder. And, this really looks like individuals who have that obsessive need to check their messages, update their Facebook status, or even, you think about all the phone games that we can put on our phones, addiction to that. And so, the reality is the more we use technology, the more sedentary our lifestyle becomes. And so we know that if movement and exercise has been found to combat depression, anxiety, if we're kind of sitting and only engaging in technology at work and at home, we're really missing some opportunities to increase our general overall physical health.
Certainly. And I could see where, again, it goes back. What does it always go back to? Moderation, right? Too much of a good thing can work against you. So what about as we're assessing the mental health of our team members, or we're trying to get a view of the landscape and be mindful? Mm-hmm. Are there like red flags out there? Are there questions we should be asking, or what should we kind of be aware of if we're trying to be mindful and be good stewards of the mental health of our workplace?
Yeah, absolutely. I think it's about leaders, managers, supervisors, human resource professionals really being trained in what to watch for warning signs for things like burnout, which can come from chronic stress. I think especially with this overlay of the pandemic this year, these kind of unprecedented times are really increasing stress for many people and kind of balancing work life, being able to manage kids at home, working in digital learning environments while we're trying to get our work done. And so what we want to do is make sure that people are aware of some of the warning signs that people may be struggling with a mental health condition. These things could be people who are having more mood dysregulation. They might be more irritable or angry, showing up with kind of this lack of motivation, people who are feeling sad or depressed, more tired or fatigued.
So be observant. Be looking for change in behavior, change in personality, change in kind of like, if you think about it, I suppose, even our families, when we're close to people inside our own family unit, a lot of times we know if our spouse or one of our children is, or maybe one of our friends that's feeling a little down, mm-hmm. and we give them a little nudge to, hey, everything okay? Is that kind of what we sort of want to see here without being too bold, but at least looking for those kind of flags and making ourselves available if necessary?
Absolutely. I think it's about starting a conversation. And so if you know what warning signs to look for, you as a leader or a manager, or even just a coworker, if you're training your entire workforce on recognizing these warning signs, we have an opportunity to create kind of an open, safe, non-judgmental dialogue with somebody to say, these are things I've noticed. Are you okay? There's a great campaign actually out there that just says, are you okay? Start the conversation.
I like some of the awareness that we're seeing on billboards and the media a little bit. And they do use these kind of keywords and catchwords to try to get people to think about it and mm-hmm. take that stigma away from that conversation. Because I think that's the hard part with mental health is initiating a conversation about it. And when you words like, are you okay? That doesn't sound too bad, right? And if I sincerely ask that, we can get a response to it. What about tools? So when I think about, we have tools for personality profiling at Marco. We use DISC, mm-hmm. D-I-S-C, very common, to help our team members understand themselves a little bit better and hopefully each other a little bit better. Are there tools in your field in mental health that are available that we should be thinking about or our listeners might want to consider?
Yeah, I think, as workplaces develop kind of anti-stigma campaigns where they make it okay to talk about this at work, part of this is building resources available for individuals who are in need of that help. But, you can use tools like Mental Health America, has some evidence-based tools on their website where individuals can go online and they can screen themselves for a variety of different mental health symptoms. I think when it's with the workplace, sometimes it's combined with a national, depression screening day, or if an employee is struggling, that can be provided as one of the resources in your resource list. I think it's important, though, for workplaces to kind of walk that fine line that this is not a screening that is required to be done. It's voluntary, that it doesn't necessarily need to be done at work. It's not something you're looking for that employee to report back to you, but it's another way to enhance helping individuals understand what's happening with them, helping them understand that mental health conditions, even suicidal thoughts, are treatable, and that it's about engaging that person and making it okay to get help.
We often talk about you have to understand yourself first so you can understand others better sometime, but know thyself. And I think it's, I think that's good advice to, to recognize that these aren't things that a workplace is going to, it's not like we're going to go around doing, hey, we're doing mental health checks today. However, we want to be sensitive. People are feeling down or feeling out and needing assistance, that we're there and we're available, and we'll put the resources into it. So thanks for that. What about best practices and programs? As we try to be a better steward of these kind of awarenesses and drive down these barriers and be more open to talk about things that impact our well-being and our self. And, there's best practices out there, and we try to look for those and maybe try to hopefully create some ourselves. But tell us a little bit about programs like EAP, or maybe sessions that we, are available to people to seek guidance and help.
Yeah, absolutely. And I think it's really important for workplaces to think about starting to build a culture versus just being reactive if there's a problem or a crisis. And so I think part of that is starting with that question, what can we gain when our employees are kind of performing at their peak levels, they're showing up to work fully engaged, and they're mentally well. And so if we start with that question, then we're really starting to think through how we can develop things preventatively. And there's actually a number of workplaces that have developed some best practices, and that best practice really focuses on campaigns that break the silence on the topic of mental illness. So very similar to your You Matter campaign that you've been running at Marco. It promotes help seeking. It really looks at enhancing a sense of connection, which we know is a protective factor for individuals who are under chronic stress or suffering with some sort of mental health condition. And then it really connects those employees also back to your company values and your goals and your ethics. And we find then that we kind of protect individuals and help buffer them from some of the more serious symptoms that they could be struggling with. And so one of the best things that I think a leader in a workforce who's listening today would be to visit the Center for Workplace Mental Health. This was developed by the American Psychiatric Association. They have a number of tools, case studies, best practices, and toolkits available. And you can access this at workplacementalhealth.org. And that can really get you started in implementing a culture of mental wellness proactively and preventively within your culture. I also think, you brought up EAP, and EAP is a really vitally important asset to companies. However, they're nationally only utilized 3 to 5% of the time. And I think, again, many workplaces wait for there to be a problem. And so if we have a problem, then we hand that referral off to an employee. However, how do we think about optimizing its use from a preventative standpoint? How do we start pitching a message and framing it as, this is a tool and another company benefit to help you be your best? And depending on your contract with your employee assistance program, they can help you with information that can be produced on stress, other things around the pandemic that you can utilize as a resource to proactively hand out to employees. Some can help you by developing little 10-minute mini educational sessions that you can implement in work meetings. And so there's a number of different things that employee assistance programs can assist with, but start thinking about it proactively versus just as a reactionary to an employee who has a problem.
Good insight. Keywords in there: proactive, like, and awareness. And so as we kind of wrap up this important discussion today about a subject that is getting more attention, probably because it needs to, and as we look to our workplaces to be as psychologically hardy as we can, I suppose at the same time we also want to interject into that the fact that they matter, you matter. And our campaign to do that has been something that we're trying to help bring attention to and make it okay to have these kind of discussions like we're talking about today. This is not uncomfortable. This is hopefully helpful for others. What are 2 or 3 things you'd like to see our listeners go away with?
Well, I think the most important thing is that really this needs to be leader-led. initiatives within your workplace.
point.
Leaders really, you set the tone, you set the culture of your workplace. And so find ways to infuse conversations about mental wellness as you talk about other business practices. I think it's important that you're messaging this to your employees. Take breaks. Work on balancing work life, model this for your employees. And even if maybe your wellness committee or you have other groups of individuals really actioning this, make sure as a leader that you're involved in knowing what's happening and being able to spread that message. And I think, again, as you had said before, Jeff, you said, I hear this word proactive. And I think the biggest thing that is a takeaway is we need to be direct about it. We need to talk about it and be transparent about it. In the same way we're transparent about so many of the other kind of business decisions that are occurring. We can break down the stigma in workplaces if we focus on being direct about it.
Well, thank you for that input, and thanks for all the dialogue and discussion and guidance you've given us today. I mean, good suggestions. And now, of course, the easy part is listening to somebody talk about important subjects like this. The harder part is to make it a part of your culture, as you said. And maybe another point is, I think we talked about workplacementalhealth.org. Not a bad place to start, I suppose, as a step to learn more about this. So today we wrap up our segment of mental health in the workplace. And if you will, make sure you subscribe if you haven't done already. Give us a review if you like what you're hearing. If you don't like what you're hearing, don't let us know. You can. And also check us out on Facebook, because our You Matter campaign is in play right now, and we'd appreciate if you would participate in that as well. We're doing some kind of fun things, and might be another good next step for you to pursue as we go forward in this pandemic and try to do the best we can to keep ourselves psychologically healthy.